everyone, thank you everyone for watching with the last video I posted, not quite long. Thank you so much, I really do appreciate it. Okay, on this channel right now, just like what I usually tell you guys, that you're gonna learn everything about fertility. And today our topic for today is 3 things every woman should know about their fertility. I know you're eager to know what this is all about, but the key point of these 3 things, our number 1 is age actually affects fertility. Yes, number 1, age affects fertility. I'm sure that there are a lot of people that are concerned that why did age actually affect fertility. Okay, this is how it actually works. In my last video, I talked about the age affects fertility and the quality of the eggs also matter depending on the age. Do you remember? Please, if you did not, go and watch the video. I also explain better about it. So age actually affects fertility. You can't really compare someone that is as young to someone that is older. Okay, this actually occurs when you're over 35 years of age. The quality of the eggs actually reduces. How are you going to know this? This is by going for scan, abdominal scan, pelvimetry scan, or transvaginal scan to check the level, the antral follicular count, which is the count of your follicles on the right and on the left ovary if you have 2 ovaries. While there are some people, they actually have 1 ovaries at the front, while the other one can be at the back based on the anatomical positioning. Don't be disturbed. And 1 ovaries is more active than the other, just like how the female breast is more active, is more bigger than the other. Don't panic. It's actually a normal thing for some female, majority of all the female. Okay, so how did age actually affect fertility? If you're over 30 years of age, it is advisable that you do your you go for your gynecological consultation. A gynae. Reason because when you have a consultation with a doctor, they can easily tell you what next to do, what are the next steps you should do. As a lady of over 35 years of age, I will advise you. Do you want to know? My advice for you is that freeze your egg if you do not have any partner at all. The reason why you should freeze your egg is because the more you grow older, the level at which the quality of the eggs reduces. If you're 20 years of age, the chances of you having good quality eggs is very, very high. Just like the more older, you can't really compare someone that is as young, agile, they have strong bones, compared to someone that is getting older, the bone become weaker. That is how the quality of the eggs also is. Okay, the other one, which is the number 2, is ovulating time matters. You also need to know the time you're ovulating. There are so many people out there, they don't know when they're ovulating. This is because they do not understand their body. And I'll be shooting another video that I have to go details about. I have to provide more information about ovulation. You need to know when you're ovulating. You need to know when you're not ovulating. When you're ovulating, you know that, okay, this is my fertile stage. When you're not ovulating, know that is a very free time stage where you enjoy any sexual intercourse you want to have. But when you're actually ovulating, that is when you feel more horny. Some people actually have basal body temperature, whereby their body temperature is higher than normal. That means sometimes when your body temperature is at 36 degrees, your body temperature can be over 36 degrees at this particular time. Your vaginal discharge also matters if you're ovulating. There are some people also, some female out there, when they are ovulating, they can also see a mucus discharge, which you popularly know as kata. It's draw. That time you can easily know if you're ovulating. At that time you're at your fertile stage. So if you have sexual intercourse, 9-month course, I tell you, 9-month course. Okay, lifestyle also affects fertility, which is my number 3. My number 3 is lifestyle actually affects fertility. Stress, medications, and also maybe when you're taking a chronic substances. That's it. Lifestyle actually affects fertility. I say stress. In a situation whereby you're overworked or you're mentally stressed, this also alters the function of the hormones. That is when this type of person actually have hormonal imbalance. You know, stress also have to do with your body system, and when you're stressed, it makes the hormones fluctuate. So it can actually affect your fertility. That is why when you are in this process of IVF or fertility journey, we usually advise, as a nurse, we usually advise that you should make sure that you're happy, you're calmer, you're not mentally disturbed, because the process actually requires mental stability. With my years of experience, I realized that many people are also exposed to a lot of medication, sometimes antihistamine. Histamine medication, maybe when you're allergic to a particular thing, you take 1 or 2 medication. This can also make your hormonal stimulation and hormonal response to fluctuate. They can be high, they can be very low, depending on the type of medication you actually take. I have so many people that also say that when they take maybe like allergy medication, like loratadine and other medication like that, that it makes their period to delay. It actually works for few people, and I've experienced it too. Infection also affects fertility. For instance, if you have pelvic inflammatory disease, or I'm using this common word because people do not actually understand what infection is. Infection is when you get contacted, maybe when you're using a restroom that is not clean, your underwears are not clean, they are not as clean as what it's supposed to. Some people actually wear their underwears for 3 days. It's unhygienic. That is why I usually recommend good personal hygiene, because this can actually use to pee by blocking your tubes and cause persistent infection reoccurring. Vaginal discharge that is offensive, and abnormal vaginal discharge that you don't want to even perceive or even see. Even your discharge can be a very discolorating and abnormal sign, maybe brownish, greenish, or not as milky or as cheesy color. So these are the things that affect fertility. I'm sure I've explained a lot about this. If you are also very eager to know more, please turn on your notification button, subscribe. It is very, very important, so you can get notified immediately when I release any video. I know that I said every week I'm gonna try my possible best to make sure that I shoot a video for you all, so we can both learn. Please do well to comment on any topic you want me to talk about. Let's both learn. It is very, very important. My last word for you is that understanding your body system and your fertility to take the best decision based on fertility. It gives you the opportunity. It opens opportunity doors for you to take best decision, to also decide what is best for you when it comes to fertility. Knowing your fertility status as a female gives you that confidence, support, mentally reassuring that nothing is wrong with you. That is why you need to take care of your body as a lady. Okay, everyone, thank you so much for listening. Please do well to subscribe, like, and comment on my channel. It is very, very important. It makes me to come again and do more. We shoot so many videos, and I'm ready and willing to educate you all. Please tell me any topic you want me to talk about. Balikoko is ready for you. Balikoko is here for you, so we can talk about it and also address a lot of topics. Bye.